This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by the stoic Dr. Jason Martin.
Very stoic. He's
board-certified plastic surgeon. That's just the word that came to my mouth when you were sitting there looking all like, you're like a statue. Like you can hold it.
Chiseled.
Yep, you can.
Like Michael.
Yes, like Michelangelo's David. Yes.
Or David. I'm sorry. I was
yes. I knew what you were getting at. See, we could do the $100,000 pyramid.
I got you.
Yes. Well, if you are new to the podcast and you are listening, you'd like to watch us, you can find us on YouTube at Jason Martin MD. You can see our new backdrop that we're excited about. It's very fancy.
Very professional.
Yeah. So today we have an interesting topic to talk about. We are talking all about erectile dysfunction. And you may think, why would a plastic surgeon be talking about erectile dysfunction? We do not do like penile enhancement surgery, but I think that a lot of our podcasts, we talk about longevity and aging well and aging in a healthy way. And to me, having a happy, active sex life is a big part of aging.
Yeah, I totally agree.
Yeah, so that's why we brought in a treatment for erectile dysfunction. I think it's an important thing to talk about. And it's, it's rare that we get to talk about something that affects men.
Yeah, I think it's very, I mean, we never get male topics in here, so why not talk about this one?
Yeah. So let's start off with what is ED, or erectile dysfunction. There's common symptoms of erectile dysfunction are difficulty, obviously, getting or maintaining an erection, also reduced interest in sex, and low self-esteem. So all of those things can be symptoms of erectile dysfunction. The chicken or the egg thing kind of comes into play with low self-esteem. We'll talk more about rates of depression in men with ED coming up. But I mean, the basics of it is that you can't get an erection or maintain an erection.
Right.
And actually, there's an interesting topic in the world of talking about ED. It talks about erectile dissatisfaction instead of dysfunction, because a lot of times for men, it's not so much that they have erectile dysfunction. It's just not what they expect it to be anymore. So it's erectile dissatisfaction. And
so it loses its quality.
Right. And there's ways to address that as well.
Yeah.
So let's first talk about the mechanisms of erection. So I think most men probably understand how your penis gets hard, but looking at it from like a cross section, and this is really important when we talk about the treatments for ED, is understanding the anatomy of the penis when it's flaccid and when it's erect. The big difference.
Do you think people get weirded out by anatomy pictures? I mean, because this is what's really going on.
I mean, it's like a cross section, so it's not really graphic at all. This is just cross section.
I'm not saying the graphic. I mean, they're concerned about seeing anatomy, like what's really going on in there.
Oh, right. Like, do you really want to know?
Yeah.
I mean, you really do, because really to be able to treat this problem,
you have to empower yourself.
You have to know what the cause is. It's not like it's some like timed out or numbers game, like where once you've had X amount of erections in your life, they just stop happening. That's not why. It has a physiological reason why it happens, and it's typically because of blood flow. Unless you've had a traumatic injury to the penis or the area around the groin, most common causes of erectile dysfunction are very much related to endothelial dysfunction and blood flow.
Yeah, and Amy's going to talk about this, but the incidence of erectile dysfunction goes way up with things that affect blood flow. And diabetes obviously is both a nerve issue and can affect blood flow too. People that have pre-existing vascular disease, I mean, they're going to have a higher incidence of this.
Yep. And we will go over all of those causes in detail. One last thing on this slide, it's not just the ability for the blood to get in, it's preventing the blood from going back out. So it is kind of there are sometimes in treatment of erectile dysfunction, you can get the blood flow back, but if you're not having retention of the blood flow, that's why you may lose an erection when you don't want to. So there's ways to address that as well. And that is kind of the multi-factor or multi-dimensional way of treating erectile dysfunction. Is it's not always just the blood flow in, it can also be the blood flow out that can be the problem. So let's talk some statistics.
Yeah, I don't know these statistics. Tell me about it.
So the rates of ED increase on average by about 10% with each decade of life, which means that by the age 50, 50% of men are experiencing some changes in their erection quality or some ED. That doesn't mean that they have, full-blown ED all the time. It's more that erectile dissatisfaction is maybe setting in, or things are just not like they used to be. It's estimated that by 2025, 322 million men worldwide will experience ED, which is a pretty shocking number. And again, that goes back to how do you want to age? If you're living longer and feeling good, do you really want to not have erections for the last 30 years of your life?
Right.
When you could treat this earlier in your life.
Well, that's kind of alarming that 50% at 50.
Yeah.
I didn't know it was that.
Yeah. And that's not full blown. I mean, that's maybe some.
No, I know the quality part of
quality
it.
part.
Yeah, but that's something that they experience and can appreciate.
Yeah. And you think about.
So half of all men.
Yeah. You think about the age-related illnesses that might be affecting men around 50, especially historically, when heart attacks and other things were more.
So you have hypercholesterolemia or high cholesterol. You have diabetes. You have hypertension. That's going to be a big one. High blood pressure is really disastrous to your blood flow anywhere. Mm-hmm. And it really affects those small end organ areas, your penis, your organs, your eyes, all these kind of things. So if you live in a chronic high blood pressure state, it can be, disastrous.
Same for high blood sugar. Mm-hmm. Same
and
idea.
And again, I know this is primarily a plastic surgery and beauty podcast, but Amy and I know some stuff about this. As you age, the blood vessels get a little thicker, and they don't have the flexibility they had before. So any kind of hose that doesn't flex to the flow of some sort of pressure inside and it keeps its shape more, it's stronger, it's going to transduce down a higher pressure along that vessel. And that's going to go not just from your big vessels, like you've heard of the aorta and all those kind of things, but go down to those end vessels on your fingers and your penis, all those really small things. And it's going to kind of wreak havoc in those areas. And high blood pressure is probably one of the most common things you'll see with age, because our blood vessels get less flexible over time.
Mm-hmm. Absolutely. And that's, I think the last couple of years, people have become more aware of the term endothelium and issues with the endothelium. And that is
with COVID, obviously, because the big hypercoagulability, I'm sorry to keep interrupting.
No, it's good.
Yeah. So the hypercoagulability problem with COVID comes from the endothelium. Mm-hmm. I forget I read an article on kind of the mechanism of how that occurs, but these people just get these kind of endothelial processes going on, and then hypercoagulability, meaning that they get blood clots. And that's where the big problems from COVID came from during those severe cases. They were getting blood clots in their heart and their lungs, and in their organs, having organ failure. And ultimately, many of them died because of that. So endothelium is where the bad cholesterol works and causes the intimal damage. Endothelium, it's pretty much everything we worry about happens with the endothelium, it seems like.
It does.
Do you know what I'm saying?
Yep. And that's the lining of blood vessels.
Yeah, the lining of blood vessels.
It has, and when you're talking about high blood glucose, high blood sugar, high cholesterol, all those things, high blood pressure, that all is affecting the endothelium. So that's why we care about the endothelium when we talk about erectile dysfunction.
Yep.
This fact I found very interesting was that, I should have made you guess what country, Nils, what country has the lowest rates of ED?
Ooh. Oh, I haven't looked. Okay, I'm going to say Finland.
Okay.
That's my new favorite country.
Which would make sense because they have a high intake of omega fish. So
it has to be.
I would go
it has to be.
I would go Mexico or Spain.
It has to be something with indigenous people that eat indigenous foods.
Yeah. Or they just like to get it on a lot.
Oh, okay.
Nils actually got it at Spain.
Oh, you son of a bitch.
Yep, Spain has the lowest rates of ED.
Why do the Spanish people, they're all good looking and they have no ED.
That's why.
Yeah.
I know.
They're all too beautiful. And they're somewhat higher in the United States. And I think that shows a lot of our lifestyle factors in the United States. As we all know, things like obesity.
Smoking, obesity, drinking, blah, blah, blah.
All bad for your endothelium, all bad for your penis. So let's take a quick break. When we come back, we're actually going to deep dive into a little bit more of the cause. And then also, I'm really going to deep dive in the treatments. So if you've considered treatment for erectile dysfunction from pills to implants, we're going to cover all of that.
Awesome.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and it's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked is really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs, or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
We're back. All right.
Actually, with Let's Get Checked, I remember we checked my testosterone before.
Testosterone, you can do men's health hormones.
And we did it. I had it drawn like with LabCorp, like the kind of legit place, and we did it with Let's Get Checked, and it wasn't the same number, so it came out the same.
Which it should be.
That was our little local test.
Yeah, they'll also do like hemoglobin A1C and other glucose monitoring. Yeah, so definitely a good idea. If you're experiencing any type of erectile dysfunction, you should get your lab work done.
And you should see your physician.
Yeah, very first, because there's things that might be wrong. So what causes ED? I think this is a very interesting thing to talk about. Very top thing for a lot of men is medication related. So your own blood pressure medication is the most common culprit of having issues with erectile dysfunction. The biggest natural causes, let's say, is going to be vascular disease. And Dr. Martin, you brought that up at the beginning. So 64% of men with erectile dysfunction have heart attacks, and 57% are associated with bypass surgery.
Whoa. So you're saying that so they're saying at some point in their lifetime, if they're diagnosed with erectile dysfunction, they're going to have a 64% chance of a heart attack?
64% of men who have heart attacks have erectile dysfunction.
Oh, I'm sorry. Okay, that makes me feel a
other
little
way
bit
around.
better. I was like, oh
Yeah.
my God.
Yep.
50% of all people over 50, I'm doing 64% of that.
No, other way around.
It's like,
Yep.
all right, so I have a 1 in 4 chance of getting a heart attack.
No, that's not it at all.
Okay.
It means if you had a heart attack, you have a greater than 50%. There's a greater than 50% chance that you also have erectile dysfunction.
I got you. That makes more sense.
It does. And that's for all the reasons we talked about, the endothelial issues, blood pressure regulation, all of those things are going to impact your ability to get and maintain an erection.
Right.
Other natural causes, diabetes, blood sugar. Blood sugar dysregulation is terrible for your endothelium and so damaging to the blood supply in all areas of your body, but especially in your extremities, which I guess you could consider the penis an extremity.
Right.
These are,
And then I'm not sure, again, I'm not an expert. I'm just going to make it real clear. Nor Amy nor I are like the experts in ED, but with diabetes, you get this neuropathies. And they call it primarily peripheral neuropathies. We see this a lot in plastic surgery because people with diabetes lose sensation on their fingertips, on their feet, and they can have sores there that require surgery. It's a lot harder for them to heal wounds. So they'll go to a wound care clinic.
yeah.
But that same idea of neuropathies can happen in the stomach, and it can happen even on the autonomic nerves and the whole processes that control, erection. So, I mean, it's not just a vascular problem. It can be a nerve problem too.
Yeah, and that's where like injury to the groin can be a big factor.
And I'm sure you're going to talk about this, but prostate cancer with surgery has a high incidence in some of the treatments, especially the surgery stuff. Now they're doing it with the Da Vinci robots, and they're doing this really, really cool kind of robotic surgeries for prostate removal. But the nerves that control erections run through the prostate gland, and with the surgery or the treatment, you can have a much higher incidence of ED, and those can be very problematic and sometimes can't be helped with treatments.
Well, and there is a treatment. I mean, that's where penile implants come into
penile
play,
implants.
and we'll talk about that. So there is
a very common
solution.
surgery.
Yep.
Like they do it weekly at my OR.
Yeah.
So
it's very common.
it's
very high rates of success.
Yeah, and I don't know. It's not very much talked about, which is really weird. Like men problems.
We're going to talk about it.
Yeah, I know. Okay, but men problems. It's weird. I don't understand that. Like we're more open about some of the female things that we do, like slings for post-pregnancy.
Well, it's because women talk to each other about those things too.
You're right.
Whereas I don't think a lot of men are really excited to talk to their buddies about their ED.
I know, but if it's 50% of all men over 50, then maybe people should start talking about it.
Right.
It's like half of all men in America over 50 deal with some problem with this. I mean, maybe this should be more discussed.
That's why we're discussing it.
Okay.
Yes.
That's why we're doing
See?
this.
I like it when you get stand up for men's health, like I stand up for women's health. Yes, Dr. Martin,
Yeah, you
get
just
angry.
led me right down that path.
Yes.
I'm very pissed off right now.
Yes. So other things that are still considered like the natural causes, renal failure, COPD, which is chronic inflammatory processes of the lungs, essentially.
Yeah,
your lungs.
obstructive, yeah.
79% of men with ED are overweight. So obesity is a huge factor. And that goes into what Dr. Martin was saying, not only about the nerves, but also the muscles that are supporting the groin and the ability to maintain an erection. When you have a lot of excess weight pulling down on all of those tendons and ligaments as well, it's going to be much harder to kind of fight the force of gravity pulling down with a massive amount of weight into the groin to get an erection.
Yeah, and then forgetting all that stuff, just at its baseline, people that are obese have what's the conversion to estrogen in the fat cells? I'm forgetting the testosterone, which is normal in men, the sex hormone, which obviously can contribute to your ability to function sexually, can get converted to estrogen, the female hormone.
That happens in the fat cells.
Yeah, in the fat cells. And the bigger your fat cells are, the more volume of fat you have, the higher amount of conversion there is from testosterone to estrogen. And so people with obesity tend to have some dysregulation of their hormones. And you'll see a higher estrogen level in comparison to testosterone, that ratio. And that in itself can lead to a lot of these problems, just the hormone dysregulation alone.
Yeah, inadequate testosterone for sure.
Which, by the way, for women with breast cancer that are estrogen positive, one of the factors that they can control after treatment, surgery, and radiation or mastectomy is weight loss, because that decreases the conversion of whatever testosterone is there to estrogen, and it's aromatase. That's what it is. They take aromatase inhibitors, AI inhibitors, so
to block the conversion.
To block the conversion.
Yeah. Yeah, and then depression, and this is depression is such a challenging thing to treat. But obviously, if you're depressed, your sex drive may be reduced. People who are
of course. It's like, it's cyclical.
It's cyclical.
Yeah, you feel for these people, and like especially just depression alone.
And SSRIs can
and SSR,
your sexual drive. So
difficult problem.
It is. So you're depressed and you don't want to have sex, and then you get on SSRI that also like reduces your sex drive. So you still don't want to have sex. The lack of desire is also considered part of ED, because it's the ability to maintain an erection or even get one. So it may not be even like physically with the penis that is the cause of your erectile dysfunction. It could be coming from your brain or your nerves or other things.
Yep.
So that's why it's not just one solution to treat it. Smoking and illicit drug use are common in younger men, and that's why we're seeing rates of ED increase in younger men, like even into their 20s, which used to be completely unheard of. If you look at research on erectile dysfunction from like the 80s and before, they talked about it in men in their like 80s and 90s, like 70s, 80s, 90s. Like now we're talking about rates of ED in men in their 20s or even in their teens. One thing I did not put on any of these slides that actually can increase rates of ED is like overuse of porn, because you basically lose the ability to be stimulated by anything that isn't like very, very graphic and very, very overstimulating. So you don't get aroused by the same things that nature would want you to be aroused by, because you're so overstimulated by consuming so much pornography. And
if you want to know that in relevance, go play some of the video games we played like 20 years ago in comparison to now.
Yeah, we were talking about being overstimulated.
Yeah, like the video games now is like, everything's in your face, and then you go and you look at Donkey Kong, and it was like this, like this 2D kind of thing. Exactly.
That was more than 20 years ago.
Well, whatever.
Yeah.
We're not measuring.
Right. That's right.
I guess we are measuring. But yeah,
no.
Sorry. Go ahead.
So like we talked that there are a lot of treatment options. The one that we have in our office and the one that we're going to talk about first is a treatment that is called shockwave therapy, right? That freaks people out because you don't want anything shocking your penis, right? That sounds terrifying. But it's low intensity shockwave therapy that actually, I have a slide that shows what it does. So it causes very, very microscopic damage, essentially, right? Or stress. Let's say stress because it's not damage in that way, but it causes stress to the tissues, which causes them to vascularize again. So it's bringing blood flow and it's bringing oxygen to those areas. This kind of shows the endothelium here we've been talking about so much, right? In all the different areas. And what that does is increase all of the ability for these tissues to contract like they should, increases the smooth muscle contraction, which is the ability to kind of maintain your erection, to keep that blood flow in, to get that muscle to contract.
Increases nitrous oxide for sure.
Yeah.
So anything we do with these aesthetic treatments, and this is why ED treatments have some correlation to aesthetics, is in aesthetics we'll go and do these treatments on the face or maybe even on the body when I do liposuction with radiofrequency, and you cause a controlled damage. Mm-hmm. When you do that, what it results in is new blood vessel growth, collagen deposition, and rejuvenation. So doing that with radiofrequency energy or a laser energy for your skin, right?
Or shockwave
therapy. It doesn't really, and people get caught up in the mechanism or the type of energy, and shockwaves is an energy.
It is. It's like an acoustic wave.
It's acoustic wave. And by the way, if you know what else uses something like this, or I mean, an ultrasonic acoustic wave is vaser liposuction. But all these things are there to do controlled, damage is not the right word, controlled stimulation of the soft tissue to regrow blood vessels, to increase collagen, to thicken the skin, et cetera, et cetera.
Yeah, and that's that stress, and that's why electroshock therapy has been used for years for treating like kidney stones and other things that are deeper into the tissue, because it has that ability to penetrate deeply without pain. So they're pain-free treatments. It helps increase blood flow.
How painful is it?
There is no pain. It literally none. Like it almost feels like there's like a puff of air against your body, maybe. But that's it. You can hear it because it's loud.
It did mostly work on the corpus cavernosum, the dorsal side of it. I mean, or is it circumferential that you're doing these treatments?
You only need to treat one. So when you're treating the actual shaft of the penis, you treat one side. You can treat any side. It doesn't matter. You can treat the top, the bottom, from the side. But then you also treat, like you kind of point toward the crus or the groin, because that's where the blood flow is coming from.
Okay.
So you're really trying to stimulate the blood to the actual shaft of the penis, but then also where the where the blood is coming from.
Okay.
So it increases it in both ways. So these types of treatments, Duo and others that are similar, are very safe and healthy, are safe for anyone who's healthy enough for sex. That is sometimes a challenging conversation to have with people, if they're being treated by a cardiologist, or if you've had a recent issue with your heart, you do need to make sure that you've been cleared to have sex before you start trying to have sex, right? So if we're not going to do ED treatments on you if you are not cleared for sex.
But besides that, most people are going to be a candidate for this, which is why it's nice. It has a very minimal to zero risk profile.
Correct. And that
it's
is
just how much of a change it can make, and then the duration of that change. Is that correct?
That's correct. And it is something that as long as you're healthy enough for sex, you may have other issues that are going on. Like if you have really uncontrolled blood pressure or uncontrolled blood sugars, are you going to get the optimal result? No, because you're not optimally healthy. The healthier you are coming in, the more result you're likely going to get. And also there are other factors at play with ED, which we did talk about, which are things like depression and other things that might be going on. So this is only treating the physical symptom. This is not treating any of the emotional or other symptoms that might be causing
the
your
central
ED.
problems.
Yep. But it is, low risk.
Yeah, it's a low risk and it's a high gain procedure. And
results last for up to 2 years in most men.
Right. If you have central issues, you're going to have to treat those. Things related to, depression and all that kind of stuff, but also like systemic conditions like diabetes and hypertension. But this would augment, your treatment of those conditions.
Yep. And the nice part is that this is a very, like Dr. Martin said, low risk, but also low conflict, You're not having to take pills with you anywhere. You're not having to give yourself injections, which we'll talk more about. Your partner doesn't even need to know you did this. Like there's very little needed to make this happen. You come in, you do the treatments, they take about 10 minutes.
Treatments? 10 minutes?
Oh, and that's start to finish. That's like including cleanup. So very quick. It's a series of 6 treatments and again, this is for the duo. There are other shockwave treatments that are different and may have different protocols, but it's easy. You come in, you do it once. It's 6 treatments. If you have a very complicated history or a complicated health history, we may do up to 12 treatments to get you optimal results. But it's something that you can do when it's not like a high pressure situation, is what I like to say. So you're not like literally actively waiting to have sex and hoping that something works.
Yeah.
There's
that seems kind of
pressure.
Stressful. If you have any kind of, supratentorial issue, I think the waiting around hoping this works thing would be stressful. I wouldn't want to be in that position.
Exactly.
So it's nice to be able to do something on your own terms without the performance stress.
That also addresses the root cause of the
it addresses
issue.
the root cause and has minimal to no risk.
Yeah. So it's actually regenerating that tissue and
so
making
what
it
else do people?
healthier.
The pills, of course. Everyone. The other options are the pills, and the reason we know that is on every commercial every day, all the time.
Yes, it's become like,
and it's always somebody in a bathtub outside. And I think historically, I would have wanted to do that, but now I don't, because I just get annoyed because if I would ever get in a bathtub outside with my wife in another bathtub and our hands are hanging across, grabbing each other.
Oh, yeah.
Looking at this amazing vista.
Sunset.
That
hopefully.
I would feel like the pharmaceutical companies have co-opted my brain.
They've won.
Yeah.
Yes. So yeah, everybody knows about pills, right? They increase blood flow to the penis. They were actually a side effect of medications. That's how they found Viagra. It was a side effect of a medication they were giving people for heart issues. Increases blood flow everywhere. So men were reporting that they were getting erections when maybe they hadn't been getting them before. So it does. It increases blood flow to the penis, but it does not fix the root cause of why you do not have blood flow. But they are easy to use. They require pre-planning, and they can have unwanted side effects. I think the most common thing I hear from men who come
headaches
in
and
is
dizziness?
headaches.
Yeah.
The ones that come in for duo treatments who have been using pills almost always say that it's the headaches.
And the flushing,
Nasal congestion is another one, just because the tissues swell in your nose, so it makes you feel very congested with pills. And of course, an erection that won't go away on its own. That can be a severe medical problem.
Oh, it's terrible.
Yeah.
I've taken care of it.
Like you have to have the blood manually extracted from the shaft.
Are we allowed to talk about this on this episode? You have to stick a needle in your penis.
Yeah. Oh, we're going to talk about that with injections.
And drain the blood.
Yeah.
And if that doesn't work, then you do a longitudinal incision on both sides.
And you can have tissue loss
of your dorsal
because
vein,
of that. Yeah.
And almost like fillet open your penis to relieve the pressure, because if the pressure's not relieved, you would destroy the nerves and then you can destroy the skin. It can be a surgical emergency.
Yeah, and the
situation.
Cross section of the penis kind of shows why that's complicated, because it's not like it's one tube.
Yeah.
It's like a sponge. So when that blood is fully saturated through the whole thing, like it's not, if you can't drain it out manually, it's not like you're going to one cavern. Like it's tiny little holes everywhere that are filled with blood. So it can be a big problem.
Yeah, that's called priapism.
Yeah.
Yep.
Cost varies. Some insurances are starting to cover it. Most men, I put on average, if you're having sex 3 times a week, most common medications are going to range anywhere from $1,000 to $10,000 for a year's supply. And that's just based on your dosage. That's another thing to keep in mind, though, that as you use these medications, you will likely need to continue to increase your dosage over time because it becomes less effective. Like it becomes less effective over time.
Is that really how much those medications are?
That's for a whole year. And that's, you can get them for less. And again, it depends on how much you're having sex and which ones you use. You can get them for less, like through some of these other companies, but just without knowing what the dosage is.
Got it.
Yeah. Injections work like pills, right? They increase blood flow to the penis, but they come with the caveat that you are required to self-administer shots in the penis 5 to 15 minutes prior to sex. That's one thing I didn't mention about the pills. They can take 30 to 60 minutes to work, and the results only last 4 to 6 hours.
So you got to really pre-plan with the pills.
Yep. And you shouldn't take them with high-fat meals. So like if you're planning on like having a really fancy like steak dinner, like maybe not the right time to take your Viagra. So the shots you have to do right before sex, like literally right before. Also, the effects are going to last for several hours. You can have the same side effects, an erection that won't go away on its own, with the addition of the side effects of injection site pain, bleeding, bruising, scar tissue formation in your penis. I don't know if I'd be signing up for that. If somebody told me I had to give myself a shot in the labia every time I would have sex, I would be like, no, thank you.
I don't know. I mean, you do what you got to do, but yeah,
Right.
It seems, I mean, on a regular basis, it seems like that would be a little bit problematic.
Yeah.
I mean, it depends on the needle size and
Well, they're little.
how
It's
much
like insulin needles.
penetration. Yeah.
They're little.
It just seems like that's a lot.
Well, and like you're going to dinner with a syringe in your pocket, and then you have to dispose of said syringe.
Oh yeah.
Like
Didn't think about that
or you go to
either.
somebody else's house and you got a like pocket full of syringes with it on a Sharps container. You're taking that syringe home with you. Like there's a lot.
And then
think about.
especially if you know, maybe this is someone newer, maybe you haven't
Right.
discussed it, that would be hard.
You're sneaking away to their bathroom to give yourself a shot in the penis and hope it works. Yeah.
That's not easy. But I mean, shots do work.
They do work.
Yeah.
So do the pills. Like these things all work.
Yeah,
These
yeah.
are all things that do work. So let's talk a little bit about implants. We mentioned it briefly when we talked about maybe like nerve damage or other issues that cause a physical incapability to have an erection.
And the most common, again, I'm not a urologist, but like I have interest in this for whatever reason. I find this very intriguing. The most common reason people get implants is prostate surgery for prostate cancer. So they had radical prostatectomies, radical removals of the prostate, which destroyed the nerves that come from your spinal cord. So they're incapable of having that nerve penis connection and having an erection for whatever reason. So
yeah. They're pretty cool, actually.
Yeah.
I mean, like they really are an interesting thing. It's the placement of 2 cylinders, so one in each side of the shaft, and then also like an inflation device and a reservoir.
yeah, if you're old enough to remember the Reebok pumps, it literally has that feel to it.
It does. That's in your scrotum, and that's actually the one disturbing thing.
It's
I
in
mean,
your scrotum, yeah.
like when you
Yeah.
look at pictures and you see people inflating their implant, like it actually looks, or when they're deflating, it's one or the other. Like it looks like they're just like squeezing the life out of their scrotum. But that's where the pump is. So yeah, and it's hidden. It is a surgery. It is real surgery. So you do have to go under to have this done. You may need to have it replaced in 10 to 15 years.
You can get infected. That's a bad
Yeah,
problem.
includes all the risks of surgery, which absolutely infection, implant erosion is another one, pump or reservoir displacement, and mechanical failure. So they can fail. They can have other issues. If you remove the implant, like let's say you had the implant for whatever reason and you didn't maybe need it, you weren't experiencing ED, once it's taken out, it basically shuts off your body. There's a reflex, and I didn't put it on the slide, but there's an actual reflex that causes your body to have an erection, and it can blunt that. Essentially, it down-regulates it so much that it doesn't work anymore. So even if you took the implant out, you probably would not be able to have erections on your own ever again if you've had the implant. Average cost is $15,000 to $30,000, but again, it is a long time. It's like a breast augmentation lasts a long time.
I think implants are covered by some insurances.
I would think absolutely.
Yeah, I mean, I don't think people are paying that out of pocket, but I'm sure it's more than 30. I mean, just for you think about the device, the OR time. I mean, it's probably more than $30,000 ultimately.
But rates of satisfaction with this surgery are extremely high.
Yeah, I mean, well, if you don't have a choice, right, you can't do these other things, pills, shots, or some of the treatments that Amy was talking about, like the one we have in our office, and this is all you have. I mean, to me, I find these surgeries inspiring. I know if you, as a man, you think about it's hard to think about these kind of surgeries and what those would entail physically. But you're talking about people that have no other options and really no hope when it comes to that stuff. And it can be rejuvenating for their life and for their partners and making them feel, whole again. If you have prostate cancer and you have to have your prostate removed, I mean, to live, a lot of these people don't have a choice. So I find these implant surgeries really intriguing.
Yeah. I highly recommend people search for like urology practices that do these and look at their before and after pictures, because I think you might be surprised that it's very natural looking erections in all ages of men, all sizes of men. Like it really is pretty remarkable.
Yeah.
Like I agree. Like it really is. So one of the other options are pumps and rings. Now I don't mean rings for like sexual enhancement. Like they actually make specific rings that are really interesting in the way they keep the blood from backflowing, essentially. So if you are experiencing some erectile dissatisfaction, perhaps with like hardness or the ability to keep an erection, a ring might be a really great option for you. And there are medical grade rings that are done like over a subscription base. So they send them to you like certain times throughout the year. For a full year of that, it's maybe $700, like really good option. It does mean that you need a little bit of pre-planning, and obviously these things would be visible to your partner. However, they're inexpensive and they're very, very low risk. If it's not like you're gonna have an erection that lasts for 4 hours. You just take the ring off or stop using the pump. You can get some abrasions and other things from pumps if you're not using them correctly, because there's a little bit of a learning curve in how to use the pump you get. But if you're just kind of wanting to see if you can make a little bit of improvement, or they're a good option to start with. Especially the medical grade rings, I think are really, really interesting because they allow you to still ejaculate normally and they just help with stopping the backflow but keeping the rest of your erection as normal. And you can put it on before you have an erection too, so you don't have to be fumbling for it when you need it, like a shot.
Yeah.
So it can be there waiting. So what the best treatment option for you, as we've discussed with all of these, there's pros and cons, right, to all of them. How often do you want to think about your ED treatment? I think is number one. That's what I ask men who want to talk about the duo treatments. Like, how often do you want to think about this? Do you want to think about your ED every time you have sex? And again, then the social component of that, you then start psyching yourself out. Every time you're gonna have sex, is it gonna work? That would be challenging. Most men don't probably want to think about that. Pain and side effects. And then to me, I think the biggest one is it actually treating the root cause? Pills and injections work, but they're not actually making your penis healthier.
Yeah, I mean, the duo, what we have in our office actually is like in a sense of treating more of the root cause, which is the endothelium and the neovascularization or increased blood flow to the penis.
Making that tissue healthier,
But I think also the pathophysiology, the reason why you have ED, that has to be treated. Diabetes, hypertension, depression. And then if you're in those unfortunate cases of a total prostate removal with nerve injury, then, I mean, I think the treatment is pretty evident. It's going to be the implant situation in most cases.
Which is a great option,
yeah,
as
but
you said.
I'm just telling you, these robotic surgeries for prostatectomies are amazing. So
and using the seeds instead of direct.
Yeah, and I didn't even talk about radiation and stuff like that. So, but I do think that the cool thing about the duo, the thing I liked about the duo, and why I was interested in it for our practice was that it's not palliative in a sense that it's augmenting things that people should already be doing by decreasing the diabetes and decreasing their blood pressure, and that it's on that path of healing, right? Increasing the blood flow, improving yourself systemically, as opposed to this, kind of a palliated injection or a pill itself.
Yeah.
Again, pills and injections are probably necessary in most people, but I do think it's a great option if you're going that route.
Well, and I think this, again, going back to the conversation between men's and women's health and how it's addressed, I think women very much talk about how their sexuality changes throughout their lifespan and their ability to, maybe get aroused or be very lubricated. All those things are talked about so much with women, whereas they're not so much talked about with men. I mean, a lot of these issues that happen with decrease in erectile function, not full on ED, are very much related to aging. Our endothelium gets harder, gets more or gets less elastic as we age. All of those things that are related to aging specifically, treating those with something like the duo is really an anti-aging, a sex anti-aging treatment.
Yeah, it's more of a longevity.
It really is. Yeah. And you may still, and I do tell people this, if you're really struggling with ED, full on ED, the duo treatment may not be enough by itself, but the duo treatment with one of these medical rings, maybe you're fixed.
Or even the duo treatment with pills. I mean,
right. Or people who are not responding to pills.
Totally.
You might get the duo treatments and then the pills actually do work. If you have the ability and then getting way more blood flow there, that might be the perfect combination for you. But either way, there is to me no downside to doing the duo treatments as long as you're healthy enough for sex. Is it the perfect cure for everyone? No, but it is something that's not going to hurt you for sure. It's not going to harm you, and it's only going to make your penile tissue healthier.
Yeah. And again, we're not just, this podcast is not about pushing duo. I mean, that's what we have. We think
it's more about the rejuvenation.
Yeah, it's more the rejuvenation component.
And that's why people do the G shot or the P shot and all those other things.
A lot of other treatments. We just thought the duo.
They're not FDA approved.
Yeah, we thought the duo was the best one available. But
I think it is by far.
Yeah, but I think that the idea is to empower yourself, just like we talked about for women, is to try to make your life better, to really focus on your health and to do things that benefit you both now and in the long term. And definitely these kind of treatments do. So.
Yeah. Like, don't accept that this is just a natural part of your aging. Like, you can make your
I love that
erection
we
better.
did this topic. I didn't know what topic we were doing.
Right?
Yeah.
We're talking about men's health.
Yeah, it's good. Let's go men.
And surprisingly enough, like over the last couple of years, like researching these treatments, I've become like somewhat of an expert on erection.
Yes.
So
she's an erection expert.
Yeah.
So if you have a question, email
Like,
Amy.
I can probably answer it.
Probably answer it.
yeah, I'll talk
She
through
will
it all.
answer it plainly and openly.
Yeah.
So
Is that on your t-shirt?
yeah, I
Right?
know.
Like, ask me about your erections.
Expert.
Yeah.
That's gonna
I mean,
be her
kind of
hat
am.
she wears to the gym.
Oh my gosh, never to the gym.
All right.
So
Is that it?
that's it. Thank you everyone so much for listening. I really do want to make sure that men do feel empowered by this episode because it is a taboo topic, right? Like I mentioned, most men are not out talking to their buddies about ED. Even talking to a medical professional about it makes them somewhat squeamish or, whatever. But talk about it. Like, get it fixed. Like, start having better sex. Like, start having better erections. Like, why not?
Why not?
You get one life.
You only live once.
Yeah. So thank you,
agree.
everyone. Sorry.
Oh, do you want to do our number and everything?
I
Because
do wanna do our number and
guys
everything.
call back sometimes.
Actually, we do get voicemails, and a lot of men
For men
comment on
ever?
our,
No.
yeah, on our podcast.
Okay.
So the phone number, if you'd like to leave us a phone number, leave us a voicemail, is 303-630-9038. You can find us on all social media platforms at Beauty and the Surgeon Podcast and on YouTube at Jason Martin MD. And you can also find out more information if you go to jasonmartinmd.com/duo. Or just-
DUO, yeah.
Yep, DUO, if you want to find out more. And I do show it. I show myself putting it on my own arm, so
You can see the treatment.
you can see how it works. Yeah. So thank you everyone so much for watching. And we'll see you here next time.
Thank you so much.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.